Under our Kalinga 8-point agenda, Governor James Edduba's administration has remained steadfast in its commitment to providing inclusive and accessible social services, ensuring that the people of Kalinga have access to quality healthcare and social support. To uplift the most vulnerable, his leadership secured 94.5 million in medical assistance for indigent patients and established the first Malasakit Center, ensuring the no-balance billing policy. His dedication to bringing healthcare gaps has been recognized. He was awarded as a bridging leader by the Department of Health, the Israeli Family Foundation, and the UP College of Public Health. He continues his journey as a Romulo Fellow for Public Health, reinforcing his commitment to healthcare excellence. Healthcare improvements have been remarkable. We have exceeded national targets in antenatal and postpartum care, significantly reducing maternal and neonatal deaths while addressing teenage pregnancies. Our national immunization program has reached 82% coverage, ranking Kalinga #1 in the entire Cordillera region, a testament to our relentless efforts in safeguarding public health. Infrastructure development plays a crucial role in our mission. 102 million pesos has been invested in the Kalinga Provincial Hospital, while new hospital buildings in Rizal, Lubuagan, and Tanudan to further enhance healthcare accessibility. The Malasakit Center, launched on July 16, 2024, stands as a beacon of hope, ensuring that every Kalinga resident receives the medical care they deserve. In total of 288 million has been secured for medical assistance, crisis support, educational aid, and employment programs, reinforcing our administration's holistic approach to social services. Medical assistance to indigent and financially incapacitated patients program is also expanded from hospitals to all primary care facilities into different component LGUs. Beyond infrastructure, we strengthen stakeholder engagement to build a resilient healthcare system. Monthly PHB and UHW technical working group meetings provide a platform for collaboration, ensuring that healthcare policies are inclusive and responsive to the needs of our people. Strategic planning guides our efforts in health and nutrition equity. The approval of the ELA for Health, the Provincial Development and Physical Framework Plan, and the LIPH ensures that annual investment plans are aligned with long-term objectives. A major milestone in this journey is the SP resolution approving the upgrade of Kalinga Provincial Hospital to a Level 2, expanding healthcare capabilities and improving patient outcomes. Building a culture of harmony and cooperation is at the heart of our governance, with 8 component LGUs securing resolutions for inter-LGU cooperation. We strengthen healthcare delivery across municipalities. Our partnerships with private hospitals guarantee access to specialized diagnostic services unavailable in LGU facilities. Collaboration extends beyond government institutions. We are working closely with the Philippine Pediatric Society to strengthen our dengue prevention and control program. Meanwhile, our partnership with the Kalinga State University continues to advance health education, immunization efforts, and blood donation initiatives, further enriching our community-based healthcare approach. Delivering resilient health programs means ensuring real measurable impact. Our health indicators show promising progress, with most targets either met or close to achievement. Our active participation in the LCAP barangay level consultation workshops ensures that healthcare services reach the most remote communities, making healthcare truly inclusive and accessible. Establishing a strong governance framework for universal healthcare remains a top priority. Through ongoing orientations during local health board meetings and health fora, we continue to reinforce awareness and commitment to UHC implementation. The provincial UHC caravan brings these initiatives closer to the people, bridging the gap between the policy and action. Developing a healthcare program network is essential to our long-term vision. Challenges remain, such as the lack of Level 2 and Level 3 hospitals, non-compliance with licensing requirements, and the need for updated referral guidelines. To address these gaps, we are conducting a series of workshops aimed at refining health facility and hospital development plans. ensuring that our healthcare systems evolves to meet the growing needs of our population. Through transparent communication, strategic leadership, and unwavering dedication, we inspire our teams, partners, and communities to work together toward a shared vision of healthcare excellence. Together, we are building a healthier, stronger, and more resilient Kalinga, wherein no one is left behind.
First thing first, blessed morning to everyone, and to our partners of the Swiling Family Foundation, the UP College of Public Health, and the NCPAG, to my fellow governors, Governor Joanne, Governor Nilo, and Governor Dorothy, and to, of course, our workhorses in the province, the provincial health officers, and to the rest of our partners and those people involved in this program. You're included in the ladies and gentlemen. Of course, sayang hindi napakita yung the video on our two World Guinness Book of Record. Yung the largest banga dance, women dancing with pots in their heads, and the largest gong ensemble, men in cultural attire dancing with gongs. Right. But anyway, ito na yung dun sa first slide, of course, our health challenges. Ito na, ito yung mga health challenges namin. To preventable maternal deaths persists due to a non-fully functional referral system. The increasing road traffic injuries and deaths occur despite wide and improved roads. To those who've been to our province, yung mga major roads namin, 8 lanes, 4 lanes, pero dami pa rin nangyayaring aksidente. Rising mental health issues, including the growing number of suicide cases. And of course, the general lack of resources for health, and I think this is true to all the provinces. It's also including human resources, which impacts the licensing of health facilities and the delivery of essential services. Our health system breakthroughs and innovations of the province. Given these challenges, my provincial health team has pursued various breakthroughs and innovations. For maternal deaths, we have focused on making the referral system more functional through the development and implementation of a referral manual. Reorganizing and orienting our community health action teams, or the chats, for better coordination. They serve as a grassroots movers for improved access to health care services. Capacitating health workers on identified gaps and in knowledge, skills, and environmental constraints that were identified through a diagnostic workshop on basic emergency obstetrics and newborn care, or the BEMONC, and family planning. And of course, the strengthening the provincial review team to enhance monitoring and evaluation of maternal health outcomes. To address the increasing road traffic injuries and deaths, various committees had been discussed and planned intervention in coordination with the Provincial Peace and Order Council and the Provincial Health Board. We usually do this monthly meeting during the councils. Strengthening emergency response, we have improved emergency response team through the establishment of province-wide response team and continuous capacity building efforts. Additionally, we now have our own pool of trainers for basic life support and standard first aid. Usually kasi dito sa accidents, iba-iba yung report ng BFP sa hospitals and other sa police. So kailangan talaga gumawa kami ng common para ma-synchronize itong mga reporting. Enhanced data reporting for evidence-based policies. We have established comprehensive data reporting system through the HERES report. Instead of reporting only mass casualty incidents, the province has adopted a system to report all vehicular accidents using standard forms. This shift allows for evidence-based policy and decision-making as we continue working towards reducing road traffic incidents and fatalities. For mental health, we have taken key steps to address rising concerns, particularly suicide prevention and response. Develop a suicide reporting form ensuring data privacy and promoting ethical reporting by media partners. Organize the Mental Health Technical Working Group or the TWG to provide technical expertise and recommend strategic actions. Pass various policies to strengthen mental health programs, including an executive order mandating all offices, agencies to support the mental health program of the province, an order constituting the Interagency Council on Mental Health and Psychological Support of the province. For this, napunta kami sa Aklan with the program of the WHO. We were the one invited regarding on this mental health. Kaya lang wala na ito, Gob, kasi with the program of President Trump, nakap na lahat yung mga suporta rin sa mga agencies na ito. So we are not looking forward to that. Faced with persistent lack of resources for health, we have strengthened partnership and collaboration with various stakeholders to bridge gaps and provide responsive health services to our province. Securing additional funding, lobbied for over 200 million in medical assistance from national partners to support healthcare services. And the office of the speaker has been very helpful in this program, and of course, including the DOS for this one, and the other senators who have been approaching to help us in sustaining this program. Expanding partnership for service delivery, collaborated with private birthing centers to improve maternal and newborn care. We partners with NGOs. Itong isa dito is When the Abundant is a private clinic that's been delivering and we as a help to them, nagbigay po kami ng mga ambulance sa kanila para yun ang gagamitin nila doon sa area nila. Maintaining regional and national support, engage with nearby provinces such as Corner District Hospital, and partnership with DOS for the development of human resources, including the Post-Resiliency Deployment Program, Specialista ng Bayan to enhance specialized healthcare access. Overall, we continue to strengthen our healthcare providers network to ensure accessible, efficient, and integrated health services for all. Finalizing the referral system, our provincial health team has tirelessly conducted a series of workshops to finalize the referral manual, ensuring a well-coordinated patients flow across facilities. Strengthening partnerships, we have formalized a memorandum of agreement or MOA with the Corner District Hospital, the Cagayan Valley Medical Center as our aspects hospitals to enhance our specialized care success. And just the other day, we also signed a MOA with the Southern Isabela Hospital as one of our Apex Hospital. We have submitted requirements for HCPN contracting with PhilHealth, which we hope will provide additional resources to further strengthen healthcare services in the province. For our status of health indices, in this slide, we want to highlight the improvements to our health indicators, a testament to our collective efforts, and we celebrate both small and big wins, recognizing the progress we have made However, we acknowledge the challenges remains, and we remain committed to addressing them as we continue working toward better health outcomes for all. We have proudly joined the Bayang Malusog program and are fortunate to start the the Roberto Romulo Fellowship program. Our leadership journey has been an easy road. It has not been an easy road. It mirrors the progressive realization of universal healthcare, long and winding, filled with beautiful, varied scenery and challenging roadblocks along the way. Actually, this uh, leadership journey started when I was still the mayor. My first time as a mayor in the municipality of Pasil. I'm not tired of recounting the way how I get involved in kung paano ko naging namahal ang health. Actually, in one occasion, I have a nephew. He's a high school at that time, and we referred to St. Paul in Tuguegarao because hindi na kaya sa province kasi wala kaming district ay like second level na hospital, and when I arrived, everyone was crying. Nasa ICU yung my nephew. 7 na lang ang platelet counts niya. And near that ICU is a chapel. Pumunta ako doon sa chapel and then I prayed. Sabi ko, buhayin mo lang tong nephew ko and I will do everything in my power na to do everything para ma-prevent itong mga ganitong klaseng pangyayari. After that, that's why I started the program on blood letting, and I'm very proud that after my term as a mayor and until now, may mga tatlong local government units who is allowed, who is licensed na to take blood for blood collecting unit. And I'm also very proud that at least doon sa nephew ko, he's now a second lieutenant in the PNP. And that's how I got involved in this program. That's why my mayor, I took, and I'm very thankful to the Swilig family because graduate ako din sa MLGP 1 and MLGP 2 and itong Bayang Malusog and here itong Romulo Foundation. I'm very thankful for this opportunity. Throughout the journey, we have consistently embraced the principle of ownership, co-ownership, and co-creation in fulfilling our leadership roles and addressing pressing health issues. We took a deep dive not only into maternal health but also the realities of GIDA or the GIDA barangays. Engaging directly with communities, we co-own their challenges alongside local leaders and agencies. Much like our approach in National Task Force to End Local Communist Armed Conflict activities, together we co-created strategies and programs tailored to their needs, fostering genuine collaboration for sustainable health solutions. What we learned? We find deep meaning in the words of Mother Teresa, which beautifully encapsulate our experiences and realizations throughout the journey. Not all of us can do great things, but we can do small things with great love. This reminds us that that impacts is not always about grand gestures. It is about consistent, meaningful actions that collectively drive change. In public health, even the smallest interventions like a well-conducted prenatal checkup, a properly administered vaccine, or a timely referral can save lives and create ripple of positive transformation in our communities. I can do things you cannot. You can do things I cannot. Together we do great things. This reflects the essence of collaborative leadership. No single individual or sector can address health challenges. Throughout this fellowship, we have strengthened our partnership with and recognizing that each stakeholder brings unique strengths. By leveraging our collective expertise and resources, we are better equipped to develop sustainable and inclusive solutions to our communities. This fellowship has reinforced that leadership is not working alone, but about empowering others, fostering collaboration, and creating shared solutions, because together we can truly do great things. For policy recommendations, ito yung mga kung we have this. With this journey, we have identified these policy recommendations. And these are renationalization of the Kalinga Provincial Hospital. We are so glad that with the new Secretary of Health, may sinabi po siya na each province should have one DOS managed hospital, and we recommended the the Kalinga Provincial Hospital na sana ma-renationalize po. Kasi sa province namin, we have 6 district hospital and 1 KPH. And 33% of our budget, 33% of our budget goes to health. And we are really hard up, kaya kailangan talaga namin sana ma-renationalize ito para yung ma-savings namin dito ay mapunta sa district hospitals namin. Policy on data capture and data management for mental health and road traffic accidents are evidence-based planning. Establish and enhance a unified information and referral system by integrating interagency data sharing, standardizing referral protocols, and ensuring interoperability across various sectors. Another one, enjoin and institutionalize bridging leadership training programs for all local chief executives at all levels to ensure, to enhance their governance capacity, strategic decision-making, and commitment to the health sector. Ang laki pong naitutulong nito. As personal experience, as a mayor, nung nag-aral ako ng MLGP, it really helped. Sana lahat ng local chief executives ay mabigyan ng ganito. And of course, last, secure funding for primary care facilities and services. Sana may makakatulong dito sa amin. Thank you. Thank you for this experience, for this journey. Thank you very much po.